Back pain is one of the most common presenting symptoms to any physician's office. It's estimated that today, back pain probably is responsible for being the second or third most common presenting symptom to a physician's office. The causes for back pain typically can be anything from the weekend warrior who's outside doing more than perhaps they're used to doing, where they show up with a strained neck or sprained low back, or it can come down to someone who has more of a traumatic injury. When you think about back pain, you have to think about what age category is the person that's talking to you. The most common problems that elderly people have with regards to their neck and their back are problems related to degeneration and aging or arthritic changes of their spine, whether it be their neck or their low back. These conditions can often lead to narrowing of the canal where the nerves travel. So now you have someone with a arthritic spine, which can cause back pain. On top of that, when the spine becomes arthritic and degenerates, it becomes thickened in different areas and can cause narrowing where the nerves travel. When those nerves get pinched by this narrowing, it can cause pain down in the arms if it's a neck issue, or down the legs if it's a low back issue. When you speak about a younger population, people in their fourth or third decade, you're talking more perhaps of people that have true disc herniations. And we hear that term a lot, a disc herniation. What a disc herniation is actually is when a material that sits between vertebral bodies in a sandwich type of arrangement herniates. And by the word herniate, I mean if you think about an orange that has the pulp on the inside and a rind on the outside, if the pulp is able to go through the rind and go into the area where the nerve travel, that's a herniation that can then cause nerve irritation. So a disc herniation, just like arthritic changes, can either cause back pain alone or it can cause pain associated with pinching of nerves. Once again, if the nerves get pinched in the neck, typically it can cause arm pain, and if it gets pinched in the low back, typically it would cause leg pain. The good news is that majority of people who present with low back pain, neck pain, even associated with arm or leg pain, will get better with conservative treatment. It's been shown that patients that present with these symptoms for the first time have an 80 to 90% chance of improving within 4 to 12 weeks with very minimal involvement of actual invasive treatment.